Cotard syndrome, also known as Cotard's delusion or the walking corpse syndrome, is a rare mental disorder characterized by the delusional belief that one is dead, does not exist, or has lost their organs or body parts. It is named after Jules Cotard, a French neurologist who first described the condition in the late 19th century. Individuals with Cotard syndrome often experience a profound sense of nihilism and may claim that they are physically rotting, decaying, or missing body parts. They may also believe that they have lost their soul or internal organs. Some people with this condition may even claim that they are immortal or invulnerable because they believe they are already dead. The exact cause of Cotard syndrome is not well understood. It is believed to be associated with underlying psychiatric disorders such as depression, bipolar disorder, schizophrenia, or organic brain conditions like traumatic brain injury. It may also occur as a result of drug abuse or certain medications. The symptoms of Cotard syndrome can vary in severity and may be accompanied by other psychiatric symptoms such as depression, anxiety, or hallucinations. It is typically diagnosed through a thorough psychiatric evaluation, including a discussion of the person's symptoms and medical history. Treatment for Cotard syndrome usually involves a combination of psychotherapy and medication. Cognitive behavioral therapy (CBT) can help individuals challenge and modify their distorted beliefs, while medications such as antidepressants or antipsychotics may be prescribed to manage underlying psychiatric conditions. It is important to note that Cotard syndrome is a rare condition, and most people with such delusions do not believe they are literally dead. If you or someone you know is experiencing symptoms of Cotard syndrome or any other mental health condition, it is crucial to seek professional help from a qualified healthcare provider.